Hello everyone, this is Larry Belt with Go Medicare Insurance Plans. Hope you're all having a great day, and first thing I want to do is thank you for your business over the years. Thank you for all your referrals. It goes as well for new clients. Your support is much appreciated, and I hope to support you in return. The purpose of this video today is to show you how to shop for your own drug plan. If you can learn how to shop for your own drug plan, you'll get more information than you would have in the traditional written reports I was sending out. In addition, Medicare frowns on my creation of those written reports. They prefer that it be done through their website, and the website works pretty well, so I want to show you how to do it. This will give you the ability to help your friends, older people as well, and how to shop for drug plans. It's all pretty cut and dried. And the important thing to understand is you're going to have about 25 different choices of drug plans. There's no one right drug plan for everybody, and there can be huge cost differences between the most cost-effective drug plan at number 1 and the least cost-effective at number 25. So particularly if you have expensive medications, make sure every fall you're in the right drug plan. The site is now working as of October 1. The carriers are required to have their information in terms of costs. Everything's supposed to be approved, etc. That's pretty much the case at this point, with one exception, which I'll show you as we go a little further on. I don't want that to confuse you. So now you can start shopping. One thing I would like to mention is that if your doctor is going to be changing any of your medications between now and December 7th, don't pick a drug plan now. Wait till you visit the doctor, see what medications you're on. As well as if you may be thinking of switching out of an expensive medication in this time period, wait till your medications are finalized till you move on with this exercise. So the actual enrollment period is around the 15th of October through December 7th. So you got about 7 weeks, so don't panic. There's plenty of time to get everything figured out. And we've done people, although we'd rather not, on the 7th. So essentially what we're going to do from this point on is go to Medicare.gov, and you don't need to do it now. You can do it after you watch the video, but you're just going to type in the browser, as I will here in a second, Medicare.gov. You can also get additional help, which is kind of hit or miss with the Medicare toll-free lines that are open 24/7 at 1-800-MEDICARE. I'd prefer, if you do have questions, if you do use email, if you could email them to me and allow me to respond faster, allow me to respond after hours, etc. Larry@goinsurancegroup.com. Now, as I said, there's about 25 different choices of potential insurance companies for you. Now, most of the companies have 2 or 3 selections, so you're probably looking at about 7 or 8, 9 different companies. So, you know, Humana has a couple, AARP has at least a couple, Blue Cross has about 3. These are the 7 that I handle, because these are the ones that are good carriers that work with agents. Now, if you happen to get a plan that comes out as most cost-effective for you that is not one of these, you can enroll yourself over the phone. But I still prefer a paper application and create a paper trail so you're not getting this nonsense that, well, we never got anything from you, etc. So if your plan that you want to enroll in is one of these, I can help you with the application. You'll just, the best thing again to do is say, this is what I'd like to enroll in. Can you send me out the paperwork? Or we can email the paperwork as well. So, but Blue Cross, I just want to mention, for the first time in about 10 years, has a drug plan with a reasonable premium. They've never been a cost-effective option for drug plans. Maybe they will be this year. We'll just have to wait and see as we have people go through this process. But we'll just have to wait and see what happens in terms of Blue Cross. But don't fall in love with them because you've had them as an employer plan over the years. So at this point, I want to go to the Medicare website, and we're going to type in, I'm going to get rid of this one. We'll type in medicare.gov and go to their website. Seems to be working better each year in terms of speed and not getting kicked off, etc., even during this busy first week. So here we are. We want to go to Find Health and Drug Plans. Well, we're going to be looking for a drug plan, so keep that in mind. And the first thing you'll do is enter your zip code. Statewide, these results are pretty much all the same, no matter what zip code you put in a given state, but it's easier just to use your own, obviously. Your next choice, your next box you'll need to do something with is this one, and easiest thing to do is just, I don't know, I don't know. This will get us where we need to be. From this point, you want to enter your medications. So I'm going to enter a few expensive ones and some cheaper generics so you can see how all this works. So we'll talk about a fellow named Tom. He's not real, but we're going to be entering Tom's medications in. The first one on, he's on an expensive insulin, and you'll see there's, under Humalog, very popular insulin, there's 5 different choices of them. 2 of them are quick pens. You put the medication in your body through a pen rather than a needle. And this is what most people are using. However, the copays are the same, about roughly, as with the traditional way with a needle. But the quick pens will push you into the donut hole quicker. So for somebody that's on insulin, there's a good chance they're going to go into the donut hole, which is something we'll elaborate on here as we go further. So we've entered the Humalog in. Now we've got we're asked to pick which Humalog. So I want to pick the quick pen, and you can see there's a couple different choices. The normal dosage is 5 pens a month, but let's say we want to change that to 6. We can do that here. And there's 2 different levels of medication, 100 and 200. 100 is the normal, that's why it's chosen, it's the default. But I'm going to up his pen quantity to 6 a month rather than 5, because Tom's doctor has told him he needs a little more. So we're going to enter another insulin. You're going to see the same thing again, choice of pens. And the Lantus Solistar, that is the pen choice. And again, 5 is the normal requirement per month for most people, but Tom is using 5, so we're going to add 5. We could, again, change that to whatever level we want, but we'll go with what is the typical. So we've entered the 2 expensive medications, and now we're going to enter a few cheap generics. The first one is Lipitor, and Lipitor is not a generic, but it has a generic, so this is why I'm doing it. So we're going to enter in the brand name drug of Lipitor. We're going to pick our dosage. Let's say it's 20 milligrams a day and a quantity of 30. Now you can change that there if you want. If you're taking 2 a day, I haven't seen anybody do that with Lipitor, but if you're taking 2 a day, you can change that quantity right there. And always stay with 1 month. Choose 1 month, because we can look at 3-month options when we get done. So at this point, the website picks up and says, hey, there's a generic. Well, most people will choose a generic because it's cheaper and it works as well for them. But if you don't choose the generic, you're going to pretty much have to pay for the full cost of the non-generic. Now, there are some cases where people can't take the generic. It's rare, but there are some cases. If that happens, of course, you stay with the brand name. You pay the full cost, and then you make a request from the insurance company once you're enrolled to give you a break on it. But it's not going to be too much, if anything. So let's move on. So we're going to go with the cheaper non-generic. Okay. And the next one we're going to enter is Simvastatin. Well, let's not enter that because that's also a cholesterol medication. I'm going to enter levothyroxine. And what's nice is you can see that the actual, as you spell the name, you don't have to spell it all out, it'll pop up for you and you can make a choice. Now, make sure you have your dosages in front of you, the proper one, because if you pick the wrong one, it probably won't affect you cost-wise too much, if any, as long as it's similar type medication. These are all oral. Up here, though, there's one choice that you inject, so make sure you know what you're taking. So we'll put that in. And let's see here. We'll put a couple more in. This is amlodipine diestate, and we're going to change the dosage. We're going to change the quantity just for fun, because that's what actually Tom has taken. We'll add that. So now we've got about 5 medications on our list, and you can review them here. And we'll add one more. Hydrochloride, a common water pill for people on blood pressure medications. I'm going to change the dosage to 60 per Tom's request. And from this point, we've got all his medications in. But what we want to do here is look over here and keep a copy of this drug list ID, because if you want to come back in a week and edit or change or add, which you can do, you'll need this and you'll need the date, okay, that you did this. So keep a copy of this, and I always do this, and then I copy it and stick it somewhere in your records. Now you'll see over here you can change the dose at this point. You can remove the medication. You can add another one of the same medication, or you go up here and add more medications. So the drug list is complete. And from this point, you want to pick a pharmacy. And the first thing I'll do is I want to see all the pharmacies within 4 miles. Now, as I'm doing these for you, I always will pick Kroger, because they are a preferred pharmacy with just about all the drug plans. So I know I'm going to get a good look at my most cost-effective option. And you won't necessarily have to use Kroger when it gets down to that point, but you'll get a look at the most cost-effective option for sure. The other one I'll always pick is a Walmart. And a lot of people don't like Walmart, but they've got a really good drug plan in terms of cost, and a really good mail order option, particularly if you're on a lot of cheap generics. So at least have the ability to take a look at it. And I can't tell you how many people I've said, well, I don't like Walmart. Well, they wind up enrolling in the plan and using the mail order just because it's a good cost-effective option. So now at this point, we've entered our 2 pharmacies, and they want to know what we want to look at. Well, we want to look at the top one, which is drug plans. We're not looking at health plans here. These drug plans are generally going to go with your Medicare supplement. So now we're getting some answers, and right off the bat, I want to show you that Cigna is going to pop up as most cost-effective at this point in time, because they're not entering any cost information. It's not there yet, and Cigna's in the past has not been a very strong choice, so they're probably not going to be your choice. So ignore these if it says sanction if you're not seeing a monthly premium here, because there's no cost info ready yet. So for Tom, it looks like Symphonics Value RX or AARP are the first 2 choices, and the site is giving them to you in order of costs, and you can see they're very similar. So the annual cost for Symphonic is $3,100. For AARP, it's $3,186. And obviously, I handle the AARP. If you want to enroll in Symphonics, you'd have to call them directly, and the phone number will be on the website. But there's also, I always want to scroll down and see if, hey, maybe these are sorted by retail costs. Maybe I can save money mail order. So I'll scroll down and I'll look at these, and knowing that our best cost scenario is going to be about $3,100 for Tom. And I'm looking at the mail order options, and really, as you're seeing those mail order options aren't going to save you money. In some cases, they're going to cost you money, and if you're on some insulin, you're probably not going to want a mail order anyway. So let's just go with the AARP for this point. Doesn't matter which one. Most of you are familiar with that company. So I'll pop that open here. And let's talk about how the plan works in terms of cost and what you're looking at here. It has a monthly premium of $40.20, which is a bit higher than the average premium, which is probably in the mid-20s. But this is the best plan for your bottom line, because this system looks at all the costs. It also has an annual drug deductible, and most of the better, more cost-effective plans have that $400 annual deductible, which is your maximum allowed deductible for 2017. But for the most part, on some of the plans, you'll notice that deductible won't apply to your generic medications. You'll get them right out of the gate at a really good cost, but not particularly on this plan. So here's where we get into the bones of this thing, really understanding how these plans work. The first thing I'll do is look at costs, the initial coverage level, and then I'll quickly look at Walmart and see that they're identical, initial coverage level. So we'll stay with Kroger. And this column represents what the insurance companies pay the drug manufacturers for the drugs you're on. This is not your cost. So Tom's drugs are costing the insurance company $982 a month. That is not Tom's cost, however, though. Tom, what he'll first do is have a cost where he pays the deductible. Now, Tom's medications cost over double what the deductible is, so he'll pay into the deductible halfway through the first month. And from that point, I know this is getting confusing, but if you stay with me, it'll get less confusing. Once he's met his deductible, now he has normal copays. These are his normal copays, $40, which is pretty reasonable when you compare that to what the actual costs are. But Medicare has what they call a donut hole, or a donut hole or a gap where you fall into that if your drugs cost too much, and essentially you get an allowance. It's about $3,000 a year, and Tom is going to go through that allowance in the first couple of months because his drug costs are so high. So let's just show you how that works. Most of you won't go into the donut hole, but a lot will. When Tom goes into the donut hole where he's used up his allowance of about $3,000, he's now got to pay the coverage gap or the donut hole costs, which are roughly about half of the full cost of the drugs. And that's unfortunate because that's the worst portion of this scenario to be in terms of cost, because now he's got to pay $396 as he's in the donut hole, but he'll come out of the donut hole because his costs are so high, where the government says, hey, enough's enough, you paid enough money, we're going to help you out again. And that's called a catastrophic level. So, but you have to have really high drug costs to go into the donut hole and come out, and Tom does. So in the first month, this is really where it's easy for you to understand what your monthly costs are going to be if you scroll down here. The orange represents you've paid $400 in the first month towards the deductible. This band here represents when you've met your deductible and you've got another $18.98 in expenses for copays. The total amount also includes the gray bar, which is the premium. So the first month he's hit hard because he's got to meet that deductible. Now the second month he's gone into his normal coverage level, and he's paying about $40 a month, which is represented here in copays. So he's there for only 2 months, unfortunately. In the third month, he pays again his $40, but he's starting to go into that donut hole already in the fourth month. So his costs for donut hole or coverage gap is $91.41, and so that it's all totaled up there. Now, as you can see, in the next 4 months, he's fully in the donut hole, and he's paying a total of $437 for all his medications combined in his premium. So the donut hole costs are $396.60, as we can see represented here in the coverage gap. In the ninth month, September, he starts to come out of that, fortunately, and his costs have dropped from $437 to $363, and he's just barely in the catastrophic level at $8.25. So He finally gets some relief in month 10th, 11, and 12. So people really just care what their bottom line is, and this can look like a lot of gibberish. But if you really want to understand it, come down here and look at this information. So there's also some interesting information here. You can tell what tier you're in here. But if you really want the guts of the report, go to, well, let me drop down here further and show you something else. You still have the ability to change, add, delete, as you did earlier on here. So if you want to drop something or you notice something's wrong, you want to change the dosage. Or you might say, well, you know what, this medication is not helping me, and I'm going to demand my doctor take me off it. You can remove it there, but obviously don't do that without carefully consulting with your doctor. But at this point, if you want something nice to look at that has all this information that you carry around with you, perhaps take to your doctor, show to your spouse, etc., you can print the plan report. And just leave all these default things checked so you get the info you're looking for. And I'm going to print it here. The best way to print it is to right-click and then print. That's how you do it at this point. So then you'll go over here and be able to print it, but I'll cancel out of it for now. But you'll see all the pertinent info is here, what you're on, quantities, dosages, etc., if it's a generic or a brand name drug. So it's a pretty good list to have. And then again, we've got the graph, the bar graph down here that is a good aid, so you can budget for what your costs are going to be. So now you've printed that. Another thing you can do, if you don't know, is a lot of you'll have the options on your printer to store as a PDF. So I can change that. If you're using Microsoft Windows, you might see this option, Save to PDF. And if that happens, we're going to save it, and then we'll just put Tom's there, and then we'll save it that way. So now you've got it on your computer as well as carrying it around in your hand. That pretty much sums up how this site works. I hope this has been important to you or helpful to you. But what I want to do now is I want to go back as if I'm doing this a week later, okay? And I want to look at my medications again. So we'll exit out of there, and we'll pretend we're new, okay? And I'm going to go to Medicare.gov. I'm really pleased this site is working as it's supposed to this early in the year, so that's a good thing. And we're going to find health and drug plans. We'll click that as we did before, and then we have to enter our zip codes again. And again, I don't know. I wish there was a little quicker way to do this, but you got to go through the first few steps. So we get to this area where you can retrieve my saved drug list rather than having to re-enter. So put that in there, and then the date obviously was October 6th, which you'll probably have to change if you're doing this later in time. Gives you the ability to do that. And then we're seeing our list here. And from this point, you can add more medications. If you've got new medications, if your doctors have changed the medications, you can delete, you can change your dosage. And again, if you think you'll be visiting the doctor between now and early December, hold off on doing this, or hold off on enrolling in a drug plan until you know for sure what your medications are going to be, at least as well as you can for next year. So that kind of wraps things up, and I hope this has been helpful. I hope you'll have the ability to, show your friends how to do this. And if you want or at least help your friends do it, if you want the list of the carriers I carry, then I guess I don't carry them, I handle them. I'm contracted with them. This is it. Humana, ARP, Blue Cross, First Health, Envision, SilverScript. And it's also important to look at the drug plan information from the carrier you're on now. They're going to send you something in early October about how that plan is going to work for next year. And if you're okay with all that, then you don't really need to do this exercise. I mean, you might save a few bucks, but it's probably, if it's just a few bucks, not worth changing plans. And again, if you have questions, try to email me, Larry@goinsurancegroup.com. And we're happy to work with you as always. So that wraps this up. Have a great day and stay in touch.